the biggest non-modifiable risk factor is age. As you get older, you're more likely to have a stroke. You just can't change that. But the modifiable risk factors are the things that you can actually deal with. Like if you have high blood pressure, you should have it treated. If you have high cholesterol, you should have it treated.
Hi, everyone, and welcome to Your Healthy Dose. This is a podcast about current trends in healthcare, and I'm your host, Kim Douglas. Did you know that 1 in 4 Americans will have a stroke at some point in their lives, and that getting treatment immediately is essential? And what about aneurysms? Is there a way to detect if one will happen? Well, today I have with me a very special guest who will break down everything we need to know when it comes to strokes and aneurysms. Dr. Jason Tarpley is here. He's the director of the Stroke and Neurovascular Center here at St. John's Health Center. Welcome.
Thanks for having me.
So glad you're here.
Pleasure to be here.
So let's dive into this. We're going to start at the very beginning. What is a stroke, and is there different kinds?
There are. That's a good question. And I think it's actually quite simple. I think of it as brain plumbing. There are burst pipes and clogged pipes. So clogged pipes are more common. That's an ischemic stroke where you have a blocked blood vessel in the brain that blocks blood flow to the brain, and a portion of the brain is at risk. That's called an ischemic stroke or a clogged pipe. And then there's also ruptured pipes where you can have a burst blood vessel in the brain, either from an aneurysm, which is a bubble on the surface of an artery that can burst, or just from conditions like high blood pressure or hypertension can cause a burst pipe. So we have great treatments for both. Yeah. Hopefully that's something we can get across today, because I think it's important for people to know that the reason you need to act so quickly is because we have treatments that are really powerful and available and are time dependent.
And speaking of that, that leads me into my next question. So why is it of the utmost importance to get treatment immediately if you have a stroke?
Yeah, so let's take, for example, the ischemic stroke, which is the clogged pipe. Okay. That's more common. So that's 80% of strokes are going to be an ischemic stroke. Only 20% are going to be hemorrhagic or a burst pipe. And when you have an ischemic stroke, you're losing brain cells at kind of a staggering rate. It's estimated to be about 2 million brain cells per minute. However, there's 2 really powerful therapies. One is, along with the plumbing analogy, a Drano medication, which is a clot buster, that when you're evaluated at an expert center by experts, they can quickly determine that you're having an ischemic stroke and give you this clot-busting medication. The latest and greatest one is called tenecteplase. And then possibly one of the most powerful therapies in all of medicine is when someone has a large blockage and we can navigate a catheter up into the brain and pull that clot out. That's a procedure called thrombectomy, which is literally one of the most powerful therapies and effective therapies in all of medicine.
So what are some of the signs that someone displays when they're having a stroke?
It's a great question. And one of the most important things is that they're sudden onset. So there are physical things, which I'll go over in a second here, but I think actually one of the most important things is a sudden neurological change. Like the patient is totally normal, the person is totally normal, and then boom, some symptom develops right there. And we use an acronym BFAST to try to help people remember those things that can happen suddenly. B stands for balance. So if you have a sudden difficulty with your gait, walking, or balance. E stands for eyes. If you have sudden visual, like a vision loss or blurring of your vision, that can be a sign of a stroke. F stands for facial droop. This is one that lots of people know. You can have the patient right in front of you smile, and one side of their smile will not have proper excursion. And so they can have kind of a facial droop. That's what F stands for. A stands for arm weakness. So again, with stroke, we're talking about things that happen to one side of the body and not the other, typically. So you can have a patient put their hands out in front of them, and if one of their arms drops, and it happens suddenly, really it's a stroke until proven otherwise. Same with the S is speech difficulty. Someone's talking normally, and then suddenly either they have garbled speech or difficulty finding their words, or having difficulty with their language happening suddenly. That's a telltale sign of a stroke. And then the last letter in the acronym is T, which stands for time to call 911. So Be Fast is the acronym, and it can be a great guide for people to recognize the signs and symptoms of a stroke.
Absolutely. That's so easy to remember. And for laymen, it's easy to do too. So if you see someone having any of those issues, what do you do?
The most important thing to do is to call 911. I know sometimes people think, hey, I can get the patient to the hospital faster, but actually, as we mentioned earlier, you're losing neurons at a staggering pace, right? And when we've worked very closely with Los Angeles County EMS, and every comprehensive stroke center works very closely with their local EMSs, speaking to people outside of Los Angeles. And so when you call 911, as soon as they pick you up and evaluate you, they're already in touch with us. They're already in touch with the ER. They're already telling us, hey, this patient's coming in with this, and this symptom, and we're already getting the wheels turning to, apply the appropriate treatment for those patients. So if you go rogue and you drive yourself to the ER, we will still take care of you, but we highly recommend people take the ambulance and call 911.
Really good advice. Absolutely. So do different hospital emergency departments have different kinds of stroke centers?
In Los Angeles, we have two distinctions from LA County EMS: primary stroke centers and comprehensive stroke centers. And actually, it breaks down fairly simply to the two stroke treatments I described earlier. Every primary stroke center in Los Angeles, of which there's about 60, has the ability to give that clot-busting medication and treat strokes in that way. However, if you have a large vessel occlusion that would require a thrombectomy, you need to be treated at a higher level of a center, which is comprehensive stroke centers.
Okay, great. And what kinds of treatment are you doing over at St. John's that people need to be aware of?
Yeah, I think the treatment that everyone should be most aware of is endovascular thrombectomy. So I described earlier that we can use the Drano medication to break up blood clots, but if it's a big clot in a big artery, that requires an advanced treatment called thrombectomy. And that involves putting a catheter about the size of an iPhone charging cable. Seems like everybody knows how big that is.
Yeah.
I say catheter and people think something bigger, but it's a small tube about the size of an iPhone charging cable, which goes into the artery of the leg or sometimes in the artery of the wrist. And then through that, we navigate a smaller catheter up into the artery of the neck, and then a smaller one up into the artery of the brain, and believe it or not, a smaller one through the clot. So it's kind of like a telescope where you have a tube within a tube within a tube, and you use that to navigate all the way up into the brain. And in the case of large vessel occlusion, we can pull blood clots out in that regard. And in the case of aneurysms, which are, a bubble on the surface of an artery, we can navigate a small catheter into that aneurysm and actually fill the aneurysm, plug it up, and prevent it from re-rupturing.
Wow. So what is advanced perfusion imaging then?
Okay, so when someone has a stroke, they come in and they get a very standardized, very expedited workup, which would include a non-contrast head CT. So that's a CT scan that looks at their brain and just tells you quickly, is this a bleeding kind of stroke, a burst pipe, or a clogged pipe? And then they get two other scans. One is a CT angiogram, which takes a look at the blood vessels. And advanced perfusion imaging is really, I think of it as a what's called an ELVO detector. LVO is ELVO, or large vessel occlusion. You can also have medium vessel occlusions. And so those occlusions are really well picked up by CT perfusion. So advanced perfusion imaging is really useful at sort of detecting, hey, is this someone who may benefit from a thrombectomy? And so I think that's decent way for your
Yeah.
listeners to understand that.
And very valuable if anybody is going through a stroke. So what's the recovery process like for someone who has a stroke?
That's a good question. It can be variable. For example, I had a patient that came in on Friday night who, it's kind of a dramatic story. He was he had vertigo. He had had balance problems for a couple of weeks. And so he probably had a small stroke, but he didn't know it. He was only 45 years old. And so his doctor had prescribed some vertigo medication. His wife had gone out to pick up the vertigo medication, and she called him to check in on him. I think she needed his insurance number or something, and he didn't answer the phone. So she kept calling, eventually called the neighbor and said, "Hey, can you check in on him? He's not answering his phone." The neighbor knocked on the door. The neighbor actually said, "Do you want me to stop doing my nails?" I was in the middle of doing my nails. So she said, "Yes, please." So she knocked on the door, and he was on the ground, and his 2-year-old let the lady in, let the neighbor in. And he was on the ground completely obtunded. And actually, in his case, he had a blockage of the basilar artery, which is probably the most important artery that goes to the brain. And he was paralyzed in 3 of his 4 limbs, right? But remember, he was just well 15 minutes earlier. And so she called 911. He came immediately to the hospital, and he went through this imaging protocol I described. He had a non-contrast head CT, a CT angiogram, and a CT perfusion. And when he got those studies, we identified a basilar artery occlusion, which is an occlusion of the major artery that goes to the base of the brain and is like basically the most important artery, sort of the artery that makes life worth living, right? There was a famous book called The Diving Bell and the Butterfly, written by a guy who had suffered a basilar artery occlusion, and he was paralyzed basically from the eyelids down. This is a long way of answering your question, but
okay.
I'm coming back to it, I promise. So, in his case, he was identified so rapidly. He got on our table. He had to be intubated because he wasn't breathing for himself. And we pulled the clot out. And like literally within an hour, he woke up completely and was like normal.
And even
we took the tube
3
out.
limbs?
His strength is improved, and he actually was discharged from the hospital 2 days later and is like walking his kid around the block, the 2-year-old that let the lady in. The reason I bring that up is because 2 things. One, it tells you how important time is, right? He was 15 minutes before he was totally normal. So the wife being so vigilant really saved this guy's life. I mean, it was a team effort between us and her. But the fact that we moved so fast, he had a really rapid improvement. Your question was, how long, what do you do? How long do people take to recover? What I tell people and what I told this guy when he came in is that it's a 3-act play. The first act of the play is the most important thing, the most important act, and it's get the freaking vessel open as quickly and completely as you can. Right? As quickly and completely as you can. So we do a lot of things with our techniques to try to get that clot out all in one piece, so there's not multiple fragments there, and as quickly as we possibly can. If you can do that, that gives the patient their best chance for recovery. That's Act 1. Act 2 is figuring out what caused the stroke so that we can prevent future strokes. But Act 3 quickly becomes the most important act once you're done with Act 1. And Act 3 is rehab. So anytime someone comes to our center or any great comprehensive stroke center, they will be seen by the holy triumvirate of rehab therapies, which is speech and language pathology, physical therapy, and occupational therapy. And those services will basically serve to help rehab this patient back to where they were before, or hopefully nearly where they were before. The typical time frame for recovery is 90 days until someone really maximizes their recovery. The case I just told you about, I spoke with the patient just before I came here, and he's, a miracle back to normal. But that's a little faster than most.
Wow, that is a great story and something really important for us to to really keep in our, and you said he was 45 only?
Yeah, he was 45. So his, when you're 45, it's a little bit young, obviously,
Yes.
to have a stroke. And the most common cause of stroke in the young is what caused his stroke, where he actually had a tear in the artery. So it's kind of a fluky kind of accident. It's called a dissection. And that serves as a nidus for clot formation. And then that clot ended up going up into his brain and causing a stroke. So in retrospect for his story, he probably had a small stroke a week or two earlier when that was giving him his vertigo. And then he had a bigger clot break off and block that basilar artery.
Well, let's move into what happens when someone has an aneurysm and how you treat that.
Sure. So, as I said a couple times, an aneurysm is like a bubble on the surface of the artery in the brain. I mean, you can have aneurysms anywhere in your body, but I treat the ones in the brain. And in fact, a lot of people are walking around with one. And I don't say that to scare people, but it's estimated that probably, if you look at the Brain Aneurysm Foundation data, there's probably 2% of the population has an unruptured aneurysm. And they're usually not big enough to cause any problems, so you wouldn't really know that you had one. And in general, they don't push on anything and cause problems. However, if they burst, they cause big problems because they cause bleeding into the spaces of the brain, which is called a subarachnoid hemorrhage, and that's very life-threatening.
And then you had said how it's treated.
Yeah, so most aneurysms are actually able to be treated by endovascular means. So there's two ways to treat an aneurysm. One is by open neurosurgery, so popping the hood and going in and putting a clip on that aneurysm to prevent it from rupturing if it's unruptured, or to prevent it from re-rupturing if it's ruptured. But actually, most of them can be treated by endovascular means. So in the same way I described, where you put a catheter about the size of an iPhone charging cable into the leg or arm, and then navigating smaller catheters like in a telescoping fashion all the way up into the brain. Once you get to that very end catheter, it's actually 17 thousandths of an inch. And so you're doing this under big magnified views, and we can do really cool microscopic stuff endovascularly and basically plug these aneurysms up in a variety of ways to prevent them from rupturing.
So help us understand, our audience as well, ways to prevent a stroke from happening. Now we know what it is and what happens when you get it, but how do we prevent it?
That's a great question. I spent a lot of time thinking about this as someone who sees a lot of strokes, right? And there's a lot of things you can do. So first of all, it depends on the mechanism. Remember I told you about the 3 acts of the play. In my young guy who had the arterial dissection, that's like a fluky accident, right? He's a healthy guy. He exercises. He has a 2.5-year-old. And so in that case, it's just an accident that really was non-preventable, but there's lots of preventable causes of stroke. And so if you have diabetes, making sure that you get your hemoglobin A1C down. So I actually talk to people about making sure they know that number. Like if you have diabetes, you should know what your hemoglobin A1C is, and you should try to target below 6.5. You should try to keep your cholesterol down, and you should know what that number is. You should try to keep your blood pressure down, and you should know what that number is. Those are kind of the main medical things that we think about. But the other thing is diet and exercise.
Yeah, that was my, tell us. What do we avoid?
Yeah, I mean, I think it's kind of interesting because when thrombectomy, this procedure, which is so effective, was first publicized, it was actually presented at an international stroke conference in Memphis, and it was like Lollapalooza for like the dorkiest people in the world, like the neurosurgeons and the neurointerventionists and the neurologists presenting that we just came across the most effective therapy in medicine. And it was like standing ovations and hooting and hollering, and everyone was freaking out about this thing you can do for somebody when they're having the worst day of their life. And literally right beside that conference was a smaller room where they were presenting the Mediterranean diet. And the Mediterranean diet is I think probably more powerful than any single pill that we have. And it reduces your stroke risk by 20%. So it's pretty dramatic for something that many of us, it's really easy to do. It's not a diet that is, distasteful. It tastes great, right? So the Mediterranean diet is essentially avoiding three things, which is, or minimizing three things. I like to put it that way more: red meat, dairy, and concentrated sweets and sugar, right? And then increasing all those healthy foods that we eat, like legumes, fruits, vegetables, nuts, poultry, fish. That is something that I think everyone should pay attention to. 20% stroke reduction is pretty big.
I mean, those things that you just said, forgive the pun, but it's not brain surgery. I mean, we hear that all the time, but it just seems like we're looking for this secret bullet or something.
Yeah, and I think that was the thing that struck me when it was presented right beside thrombectomy. All of us got so excited about thrombectomy, but we also have the ability to prevent strokes, and it hasn't gotten as much attention as it should, but it's powerful.
Yeah. And what about exercise? You look like you do a lot of exercise. How does that help us prevent a stroke?
Yeah, I mean, this has been studied a lot. I think it's kind of funny, like how much is enough and how much is, is there too much? I will say that studies have shown that really there's no amount that is too much. And I exercise a lot, but what I tell my patients is really pick something you're going to do, and you're going to act like if you just had a stroke and you never exercised before in your life and you're 70-year-old, probably you're not going to hit the weight room every day now, right? So pick something that is going to be something you're going to actually enjoy doing, but really all of the studies have shown that exercise prevents stroke, and really there's no amount that's too much.
So walking, even just simple as
Absolutely.
That. Great.
I recommend walking a lot to my more senescent patients who have not exercised prior. Also in patients who have a tendency to fall, things like Tai Chi are actually really good. You can get some exercise doing it, but it can also help balance, and there's really good studies on that too.
Okay. So is there a certain demographic that is more likely to have a stroke or an aneurysm?
Yeah, it's probably different for the two. So on the stroke side, as we discussed, there's modifiable risk factors and non-modifiable, right? So the biggest non-modifiable risk factor is age. As you get older, you're more likely to have a stroke. You just can't change that. But the modifiable risk factors are the things that you can actually deal with. Like if you have high blood pressure, you should have it treated. If you have high cholesterol, you should have it treated. If you have diabetes, those are things that make you more likely to have a stroke. With respect to aneurysms, actually being female makes you at higher risk to have an aneurysm and have an aneurysm rupture. Having smoking, high blood pressure, and cocaine use are kind of three big risk factors. I have to say most of my aneurysm patients don't have all those risk factors, or they may have one. And as I said, they're just really common. There's about 2 or 3% of the population walking around with one. It is important to note that we probably shouldn't screen everybody with a CT angiogram to see if everybody has an aneurysm. But if you've had an aneurysm in your family, that's a risk factor. So there is a genetic component. And every time I treat someone's ruptured aneurysm, I recommend that they have their first-degree relatives get screened.
Oh, that's smart. That's really smart. What does the future look like for strokes and aneurysms?
It's pretty amazing, I have to say. It's a great time as a stroke doctor to be alive, because especially endovascular therapy is just pushing the boundaries. I mean, it's a field that is, first of all, it's entirely based on solid, sound scientific research. And, literally 10 years ago, we didn't have thrombectomy in a widespread manner, right? It was really 2015 that the clinical trials demonstrated that its benefit, and now we have just expanded and expanded. So now we go out into farther vessels. We do things that 10 years ago we didn't think are possible. So that's on the ischemic stroke side. And on the aneurysm side, I think it's the same way. The both open surgical and endovascular techniques are just getting better and better and better, and we have better treatments to offer patients.
That's encouraging. So now let's talk about you. So what attracted you to neurology?
I think a lot of what I knew I wanted to do something in brain science. I actually was a neuroscience researcher before I went to medical school, so I kind of knew that I was going to do something in neuroscience. And I lived on the East Coast, and I moved to the West Coast because there were lots of top programs here. Like 4 of the top 10 neuroscience programs were here, and I thought I'd come out here and get it out of my system. And Angelinos know what happens when you do that. You end up finding a reason to stay. So I did a PhD in neuroscience, and then I think, I was at UCLA doing my neurology residency, and I think I just really thought it was cool that someone could be having a problem in their brain like a stroke, and I could sort of examine them and recognize that they were understanding my words, but they couldn't get their words out, and I could figure out exactly where the problem was in their brain. And that part seemed really cool to me. And then I was just kind of around at the right time where thrombectomy came along, and you could see that person who couldn't get their words out, and you could pull a clot out, and then right in front of you, they would start talking again. So for me, it was I just couldn't make any other choice.
Wow. And you don't sound like you're an overachiever at all, by the way, not one bit. So to close the show, if there was just one thing, Doctor, that you wanted our viewers to take away from today's discussion, what would that be?
I think the main thing that would be nice for viewers to take away is that time is brain. We have a little problem in stroke in that it doesn't hurt. And like when someone's having a heart attack, they have crushing chest pain, and that really always brings them to the hospital. But we still have some patients who their arm gets weak and they try to shake it off or they try to sleep it off. And so hopefully by telling you a little bit about these treatments and telling your audience about these treatments, we can spread the word that time is brain. The minute you have one of these symptoms, call 911, get yourself to a comprehensive stroke center, and we'll take care of it from there.
It sounds like they'll all be in very good hands. Well, for more information on strokes and the brain, please visit the Pacific Neuroscience Institute website, and that's at www.pacificneuroscienceinstitute.org.